Hello viewers, welcome back to the Medical Board Exam Experience with Dr. Kwafu. In the last few weeks, we had doctors who shared with us their exam preparation experience on how they passed the Ghana Medical and Dental Council Board exams and also the Australian Medical Council Board exams. Today, our country of discussion is the United States. We have with us Dr. Abdul Rahman Gomda, an international medical graduate of the Hebei North Medical University in China. He recently passed his United States Medical License Board exams, and he has joined us today to share with us his experience on how to study and prepare for these exams. Let us join Dr. Gomda in our discussion room. Doctor, can you tell us what the USMLE is and who is qualified to write it?
Well, the USMLE stands for the United States Medical Licensing Examination, and it's an examination you have to take in order to get accredited to practice in the United States. So it's anybody at all, any medical student at all, provided your university is in the accredited list of universities that are accredited by the MPME, the board that are assigned to conduct this examination. So if your school is accredited, you can take it from anywhere in this world if you want to practice in the United States. Yep.
Okay, so you don't have to be a doctor to write it?
Or you have to be a medical doctor to write the examination. You have to be you have to be in a process or after your medical school.
Okay, so if you're a medical student, you can write it?
Yes, if you're in the process, you can write it. Your school is accredited.
Okay, so how long did it take you to prepare for yours?
Well, truth be told, it took me like 6 to 8 months in total. Okay. But for the first 4 months, it wasn't serious studies. It was just normal, and as in maybe 3 hours in a day, 4 hours in a day studies. But for the last 4 months, I was going 16 hours, 14 hours of studies per day. Yeah, but for the first 4 months, it was just normal routine reviews. Yeah, and not very strict, not strict on the books. But for the last 4 months, I think from August, September, October, I think it's in November. Yeah, so from August to November, it was dedicated study for dedicated studies. Yeah.
Okay.
So that was so I'll say 8 to 6 months.
Okay. Yeah. So the USMLE exams is in different sessions, or just one-time exams?
No, we have 3 steps. Step 1, that is for the basic sciences, your anatomy, biochemistry, immunology, physiology, behavioral science, all the basic sciences, cell biology, genetics, all these pharmacology, microbiology, all the basic sciences comprises of step 1, and and step 2 is about clinical medicine. What you do in clinics. Now you can diagnose patients. You can what is the treatment? How do you manage the patients? That's about step 2. And step 2 is divided into 2 parts. Step 2 CK and step 2 CS. CS is like an OSCE examination where you have real patients. They are kind of like mock patients. They are doctors, but they are examinees. They are mock patients. So they present their cases to you, and then you assess them and manage them. This is a real case scenario. So that's step 2 CS. So step 2 is divided into 2, CK and CS. And step 3 is the last and final step. That one you take it during, most people take it during residency. Maybe first year of residency, you can take the step 3. But if you are an international medical student, competition for places, the competition is now very, very keen. It's strict. So if you really want to make it, you can try writing step 3 and add it to your CV. So you can have step 1, step 2, CK and CS, and step 3 to stand the higher chance of getting into residency. So if you're an IMG and you think you are ready to write the step 3, you don't have to apply for the match before you take the step 3. You can just take the step 3, and then if you pass, you can add it and you stand the higher chance of getting into your residency program you like. Yeah.
Okay. So what you're saying is you need the step 1, step 2, CK and CS to get into residency. Okay. So all these exams can it be taken anywhere, or you have to be in US to take this exam?
Step 1 can be taken anywhere in this world, anywhere, provided your country has a prometric center.
Mm-hmm.
Step 2 CK can be taken anywhere in this world,
Okay.
provided your country has a prometric center. Step 2
Okay.
CS can only be taken in the United States. Step
Okay.
3 can only be taken in the United States.
Okay.
Step 2 CK and Step 1 can be
Okay.
taken anywhere in this world, but Step 2 CS and Step 3 can be taken in the United States. Yeah,
Okay.
only in the United States. Yes, please.
Okay. So when you were preparing for these exams, did you attend special lecture to help you prepare for it?
Truth be told, I didn't attend any special lectures.
Okay.
I had all the resources I needed. I did a couple of videos and then the books. I read the Kaplan books, and then I did the Kaplan videos, and then I used first aid, and then I did the U World. So these are the resources, and then I used Patoma as well. So basically, just Kaplan, first aid, Patoma, and U World.
Okay, so those are the materials you used. Are those the only materials that everyone is supposed to use, or the other materials that?
Well, the materials are broad. You have to choose what works best for you. I think that was what I thought was better for me. So
Okay.
if you think you have other, there are some other just like Boards and Beyond, Master the Boards, a lot of books. So you would choose the one you think suits you better. Because me, reading Patoma was enjoyable. I enjoyed reading Patoma, and then reading Fetty was also very nice. Watching the Kaplan videos were they looked nice to me. I understood the materials better using these materials. You see, I
Okay.
understood the concepts better. So I think the Kaplan, Patoma, you all the first were the met my standard, and then I
Okay.
think I just did with them. Yeah.
Okay. So
But
you
the secret. Mm.
mhm.
The secret is keeping it simple. If you use too many resources, you end up confusing yourself. Just
Okay.
stick to the few resources you have, and then read them and do them very well. Once you master the materials very well, because you have the concept in your head. You have the whole concept in your head. So you just have to apply them. That's just it. But if you are swimming around resources, you end up confusing yourself. You don't know what But if you keep it simple, I think keep it simple and make it work. That was
Okay.
my motto. Keep it simple and make it work.
Okay.
Yeah.
Okay.
Yeah.
So you mentioned the subject areas that have been
Mm,
tested on.
mm.
During the exams, which subject do you think dominates most in the exams?
In my exam, I don't know. It was so funny. My exam, I had a lot of experimental questions for step 1, and I had a lot of statistics, medical statistics. I had a lot of statistics and then experimental questions. And then the next one I also had most was pathology. I think I had a lot of pathology, pathological questions. The cases were mostly with pathology, and from farm as well. Farm was not that much. I think statistics and the experimental questions dominated. But
Okay.
with this experimental question, you have to apply your biochemistry, your genetics, your DNA. They can ask you probably a case like maybe a certain DNA sample was taken from a man, and then another from his wife, and then trying to illustrate using HB electrophoresis to determine whether the sex of the child is the baby is legitimately for the man or for the woman. This kind of like something like that.
Okay.
Those kind of between those lines. You get what
Okay.
I'm trying to say?
Yeah.
Yeah,
Okay.
yeah. Between those like kind of like it's trying to like things conducted in the lab.
Okay.
You understand?
Okay. Yeah.
I
So,
had a lot of those questions.
so most medical students complain about statistics. So how did you learn your statistics?
Yeah, it's true. Cause I, I don't know any I don't know when I was taking for step. I think I did statistics last because stats is something I knew if I studied I'll forget. If I studied, even the day before the examination, I had to review everything. I made a short notes on the key formulas and then concepts that I need uh, the, to calculate because you have to memorize the formulas.
Yeah.
So I had to review most of the formulas again, because it's something that if you don't do for like 2-3 days, you forget everything. So I
Mm-hmm.
made sure I put statistics last. So I made sure that I reviewed the concepts last on my agenda. I did
Okay.
everything on the statistics last, so that even the night before the exam, I reviewed statistics again. Just
Okay.
keep the things fresh in my head.
Okay. Okay. So
Yeah.
so during the registration process, how much does it cost?
Well, you have to first get accredited by ECFMG.
Okay.
So you have to get a number, kind of like an index number, a PIN number, something
Okay.
like that, so that that's going to be your ID on the USMLE portal. You
Okay.
understand? So
Mm-hmm.
that one costs like somewhere $350 to $400 to get that number. You see? So it's with that number that you can now register
Mm-hmm.
to ECFMG for the exam.
Okay.
So the registration for the exam costs around 1,200, provided if you're writing it in the United States, around
Okay.
$900. But if you're
Okay.
writing it outside, they add extra charges, So it totals around $1,200. But if you're writing it in the United States, it's around $900 US.
Okay.
Yes. Yeah. So I took it in Beijing. So I paid around $1,200. Yeah, so in
Oh,
all, 1,006 for step one.
okay. You take the exams. How long does it take for you to get your results?
Well, it takes 3 to 4 weeks. So mine came in 4 weeks. Yeah,
For
so I was on. Yeah, it mostly comes on Wednesdays. So it
okay.
takes 3 to 4 weeks. So mine actually came in 4 weeks time.
Okay.
Yeah, so it took 4 weeks for mine to come. But some people have get theirs in 3 weeks. After
Okay.
the paper, 3 weeks. After 3 weeks, the first 3 Wednesdays. So the third Wednesday is when you can expect your results, or the
Okay.
fourth Wednesday.
So with the step one, what is the passing mark? How many questions and what is the passing mark for the step one exams?
Yeah, so for the step one, I think you have around 280 questions. So that's 7 blocks. It's a block of for a block of 40 questions, and you have 1 hour per block. So you read the questions, then deduct. You underline the things that really matter in the whole question, the question stem, and then you choose the right answer for the question. So you have 40 questions. So you have 1 hour for each block. So a block contains 40 questions. So when you have 7 blocks, so that's like 280 questions.
Okay.
So in all, you have 8 hours with your break for the whole
Okay.
examination. So you can come if you come like 8 in the morning, you leave around 8 hours from it. Yeah, so you have an hour of break. So you can split in
Okay.
between the block.
Okay.
So yeah, so it's 280 questions. And then the passing score is you need 196 to pass.
Okay.
It's a score 196.
Okay.
They have the way they calculate it. But the score, they say you have to get above 60% of the questions right
Okay.
to get that 196 score. And if you want
Okay.
an improved score, maybe want a very good score, you score above 230s.
Okay.
Above 230, you have to get a competitive score.
Okay.
So if to pass, you need to answer 60% of the questions right
Okay.
to get the 196. That's 196
Okay.
score. So if you want to, if you like, you can, some people get 200. It's a pass. 210, 220, 230, 240, 250, 266. Some even get 270. I know
Okay.
someone who got 270 on the test, 100 percentile. And so
Okay.
yeah, so it depends on how best you answer the questions, and how you
Okay.
comprehend things, and how well you analyze question stems. That will
Okay.
determine how your score goes, and how
Okay.
you understand the concepts really well. Whether or not you understand the concepts really well, that will determine
Okay.
how you score on the test.
Okay. So most
Yeah,
people are usually particular about how to study for the exams. So let's go
yeah.
back to your preparation times. Did you get any assessment questions to assess yourself before the main exams?
Yes, please. The UWorld self assessment. UWorld is like a question bank.
Okay.
You see, when you read a concept, you can go to UWorld and answer questions pertaining to that concept, relating to that concept. So
Okay.
let's say you're reading on pharmacology.
Okay.
You're reading on antiarrhythmic drugs.
Okay.
So let's say somebody has an AFib. What's the drug of choice? You see, what are the classes of antiarrhythmics? What are the drugs? So you have a question term. And the questions are being asked like, um, maybe a 48-year-old man came to your care clinic or your hospital complaining of shortness of breath, diaphoresis, maybe chest pain that radiates to the back or the jaw, maybe classic signs of angina, you see, and then pain that relieves with rest and then exacerbates with exertion. They give you signs of angina. They kind of ask, so what drug would you prescribe as a first line drug to this patient? Nitroglycerin, aspirin. They give you nifedipine, and they probably add valproic acid for sodium valproate. And you know very well that the nitrates are the drugs of choice for for angina. So definitely you go for a nitrate.
Okay.
So that's how you build your concepts. So if you are doing anti-anginal drugs, you go and answer questions relating to angina on UWorld. So you have an idea of how the USMLE asks their questions. So
Okay.
because you are doing UWorld questions. So once you do UWorld, then we have something we call the MBME. It's a mock USMLE because it's the same company that says the USMLE question. They have like kind of like a mock how the questions will be asked on the USMLE. Also, it has also 5 blocks, 40 questions per block, 1 hour per block. So you do that whole block to kind of like mimic the real exam.
Okay.
So once you do that, you have an experience. You can do MBME 12, MBME 13. There are a lot. There are like 6 or 7 of them. I think they
Okay.
even added current ones recently. So once you do the MBME, you kind of like familiarize yourself with the whole setting of the USMLE. So you have a general idea what to expect, how to control your anxiety, how to plan for the test, how to even take your breaks. You
Okay.
can learn all these things whilst taking the MBME. So during the prep, you do all these things before you choose a day and then go in for the examination. I hope
Okay.
that answers the question.
Yes. After exiting from the exams room, how did you
Mm.
feel? Did you think
I,
the exams was over exaggerated or it was under below your estimation? How did you feel?
well, I felt that I'm going to fail the exam because it is the most difficult exam I've ever taken in my life. Yeah, for me, I think it's the most difficult exam I've ever taken in my life because you. I don't know of anybody who has taken the examination and told me confidently that he believes he will pass 100%. Yes, you have taken self-assessment, you have passed all the self-assessments, but the exam is so difficult that the choices are even almost similar. The choices are almost similar. So even the question you have some you even if you eliminate like um 3 choices, you have another one that you think that one can even be the answer. So you have like 2 answers for each question.
Okay.
Is that difficult?
So
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 you
the
probably you can have so that's what. So you're not even 100% sure of all the answers that you have chosen, whether they are really the right answers, because you are even having your doubts.
mm-hmm.
So I came up with the exam thinking that hoping to pass, but thinking that I will fail.
Okay. But you said you solved a lot of assessment questions. You mentioned UWorld,
Yeah,
MBME. None of them
yeah.
looked like the main exams.
Oh no, the concept is the same.
Okay. So
The
what
concepts
made
are
the
all
main exams so difficult that uh
for me actually. I think the question stems in the main exam is far more longer than in MBME. I think MBME, I don't know, the main exam actually, I think it's more difficult than even the self assessments. That's my perspective. But even I even think that you all is actually a better mimic to the main exam than even the MBME. Because I
okay.
think that you all is far better in the way they ask the questions. It's kind of similar to that of the main exam. So I think you all was better
Okay.
a resource than the MBME.
Okay. Okay.
Yeah.
Okay. So one of the resources you mentioned, which is first aid, and for my viewer, this is how the first aid book looks like. And
Yeah.
there are a lot of people preparing for these exams, and they say the first aid is very hard to study. They don't know how to study it. How did you manage to study the content in this first aid?
I did it by subjects, or I'm say by courses. You see, the tail end of the book has the system, the organ systems,
Okay.
gastrointestinal system, the cardiovascular system, pulmonology, and then the renal system. You see, so I first of all studied them detail by detail. I did pulmonology, I did cardiology, I did nephrology, and I did I think the last one gastroenterology. So I did these four systems. So you clear all the systems, and then you now come to the basics. You come to immunology, pathology, microbiology, biochemistry. So you have a general idea of everything. Then you now add the nitty-gritties of the first aid book. I think if you read it, because seeing that you're going to start from the beginning, behavioral science, reading behavioral science, biochemistry, blah blah, pharmacology, doing everything before you come into the system, you end up confusing your own self. So you do cardiology, do the UL questions under cardiology, do nephrology, do the UL questions under nephrology, do pulmonology, do the corresponding UL questions, do gastroenterology, and do the corresponding UL questions, and have a fair idea. Then you now come to the basics, by genetics, biochemistry, pharmacology, microbiology, embryology, and then behavioral science, and to mention by the few.
Oh, okay. So how did you just start reading the first aid, or you finished? You mentioned Kaplan, you what? Which one did you do first?
Before I did the first aid, I did the Kaplan. The Kaplan gave me the foundation. You see, because you can't just start reading a book without having a fair idea of first all first, you have to memorize everything in first aid. That I can tell you, because about 70% of the questions that will appear on the examination comes from first aid.
Okay.
I can guarantee that about 70% of the questions that you see on the real exam comes from first aid. So first, you have to memorize every single concept under first aid. You have to memorize that concept. Fine. Having said this, you have to get a foundation. Fine, you do it. You do the course in med school. I took the exam when I was in my fourth year of med school. Yes, you did all these courses, but you have forgotten them. So you need a resource to freshen your memory. So I did the videos and I read the book to get a foundation. You get what I'm trying to say?
Mm-hmm.
If you get a foundation, and then you can now start memorizing every single concept under first aid.
Okay.
So once you do that, I did the Kaplan videos and books. Then I started memorizing first aid. So I read it a total of about I read it 3 times. I read
Okay.
first aid from cover to cover 3 times. The first pass was just a fast-paced pass, just to get a fair idea of what first aid looks like.
Mm-hmm.
Second pass was kind of memorization, serious memorization. Then the third pass was like I just getting to a month from to my examination. I read it in 2 weeks, just
Okay.
refreshing my memory about the whole book again
Okay.
before my examination.
Okay.
Yes, so that's how I read it, and so I recommend doing first aid at least twice. Read it from cover to cover twice. I recommend that because you would see almost all 70% of the questions on the examination from the first aid book. That I can guarantee.
Yeah. So in a way
Uh-huh.
to memorize it, some people say they have flashcards that helps you memorize it. Do you think using flashcards to prepare for this kind of exams is worth it? Like
It's
memorizing facts and
it's really, 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 really it's worth it. Seriously. Because step one is the most difficult of all the examinations. Because the mechanisms of actions of every drug must be known. The nitty-gritty biochemical information of everything, promoters, sequences, everything must be known. So you can't just say you have memorized on first aid and you don't review. You have to have something that you can easily flip through and regain that concept back again.
mhm.
Let's say, what's the mechanism of action for this drug, methotrexate? It's an anti-tumor drug. You see, and it inhibits dihydrofolate reductase activity. You see, so let's say you read it in first aid, but one day somebody just mentioned methotrexate, or one time you just see a question and you are seeing somewhere, you see methotrexate, you can't remember the MOA, the mechanism of action of methotrexate. So you have a flashcard on your wall, just back in your head again, rather than going through first aid and flipping again to see where it makes the whole work difficult. But so I'm saying I use flashcards a lot, and I recommend flashcards. So flashcards really work.
Okay.
Yeah.
That's good. So let's come back to the exams day. On a typical exams day, how is it like for step 1?
Well, when I was taking the exam, I asked a lot of people who took the exam. I watched a lot of videos on YouTube and blah blah blah. They recommended flipping the whole, taking that the day before the exam, taking a day off, not studying anything a day before the examination, and getting a good night's sleep. But believe you me, I don't think it works, because then the anxiety alone I experienced before the day before the examination, I just couldn't help but take my book and start reading something. So to others it worked, but to me it never worked. And I even had to, I was waking up like almost every hour just to make sure that I'm going to wake up on time. And so I'll be waking up to see whether it's 6 o'clock. Whether it's 5 o'clock, because I have to pray before. As a Muslim, I have to pray before I leave the house. So I'm waking up to see whether it's time. So you wake up 5 o'clock so that I can wake up, and then I'll check the time and then somewhere 1. Then I'll sleep again. I'll wake up again, it's 3. Then I'll sleep again. Then before I wake up again before it, then it's 5. And then so I didn't even sleep the whole night. I didn't have a good night's sleep, to be honest. And so, okay, let's say that everything was done. Then I walked to the promotion center. When I got there, they said I should come by 8. So I came there by 7:30. So at 7:30, so I'm sure that I will not be late. So I got there, the place was locked. So I had to wait, sit outside, calm myself down, just relax. But and then I had another second thought. Some of my biochemical, I was trying to remember to see whether I'll just trying to like mention something haywire, like okay. What's the promoter? I'll see what I can remember. It's straightforward. You see, so I was just like, so I don't know. I remember not knowing something, so I had to bring out my first aid again and start flipping through again. So all this, I want to recommend that. Look, you have studied enough. You have done everything. So forget it. That night, whatever is in your head, I'm sure you will make it. Yeah, so just forget it. You will do well because you have done enough. Provided you have put in the effort, you come out good. Yeah, you
Okay.
come out good.
So let's say you are assume you are preparing for this whole exam again. What will you do
Mm.
different?
I think I probably wouldn't have dedicated more of my time with some other resources like boards and beyond. Probably trying to look into other resources. I'll probably just stick to what I just said. The few resources that I used, and then I would also have probably I'll probably have taken the exam maybe earlier, because taking longer to take the exam to it's kind of you kind of like it's like a bucket that has a hole. Once the information you kind of get to a saturation point,
Yeah.
then what happens is that you start to plateau. Once you plateau, what's next? Then the slope goes down.
Calm down. Yeah.
So you get you go, then you saturate, then you start plateauing. You plateau, the next thing is that you are coming down. So it's not like a leaking bucket. So you study enough, then you are extending the time. You are just doing other than nothing but anxiety and frustrations to yourself. So just once you get to that saturation point, and so you like to start plateauing, your MBMU scores are within the same range. You take it like a week after, maybe you get a 250. And a week after, you get a 245. A week after, you get a 240. You know that you are in the range. You are in the 240 range. So don't even bother to say you are going to just take the examination. Otherwise, you're only going to end up it's going to end up falling. You're going to start. losing some of the information that you have already memorized. So I'll probably have taken the exam earlier. Yeah,
Okay.
so fewer resources and then an earlier date for the examination.
Okay. So, what are your final words for people who are preparing for these exams or planning to write these exams?
I would say, even though yes, it's difficult, but many people have done it. And there are lots of people who are practicing right now in the United States. People have done it. And so that should not be, the fact that they say it's difficult doesn't mean that it should scare you away from doing it. Once you think that you want to practice in the States or you want to test your medical ability, well, I think the USMLE is the gold standard in medical license examination. I think it's the most difficult. I think. So if don't just go for it, you know you have studied enough. You have done all the things that is required for you to do to pass the examination. Go for it. Don't be afraid. Ask those who have done it. Get some small tips. Add your own twist to it. You see, don't be so rigid. You see, do what works for you. I say it, what works for you and do it well. Don't be so rigid. Add your own twist to things. If you know that you are kind of like um, um, the understanding type, try to understand every concept. If you know you are the memorization type, try to memorize every concept. So you don't have to use someone's method to determine how you go about things. Try your own different ways. You understand? So I think just go for it. Prepare very hard, and I know you're gonna make it. Yeah, it's worth it. Because I came out thinking I'm gonna fail, and it came out I had a very good pass, a very very strong competitive score. So I think it's fine.
All right. Thank you, Dr. Gomda, for joining us today, and
Oh,
we hope to have you here again.